Many people think heart diseases, kidney diseases, and diabetes are of different conditions, but they are actually part of something called CaReMe disease. Tomitra, if you could explain us what this means and what's the importance of it.
For proper functioning of a human being, all the organs should function properly and in synchrony. So once a person has got a heart disease, it is our duty to find out whether he has got diabetes or kidney disease.
Are diabetes also growing in the younger generation?
So the government of India has a guideline which says every Indian should be screened for diabetes after the age of 30. So younger age, onset of diabetes, very bad.
What are some early warnings so that we get to know from before?
What happens from my cardiovascular system, what I can tell, usual things people is getting tired and fatigued.
Kidney disease don't always have symptoms early on. So what do we do about that?
Going to the toilet at night multiple times, some blood in urine. If these symptoms are there, then they should get themselves evaluated for the disease.
A fatty liver, high cholesterol, high blood pressure, all of them will probably give you a better idea. Don't stick to symptoms, test and test.
If you could talk about kidneys protection.
So it is very important that they should control the.
Hello everyone, welcome to this special podcast on CaReMe diseases. Brief you about CaReMe diseases. CaReMe stands for cardiovascular, renal and metabolic. So these diseases might sound separate, but they are deeply connected. So if you or somebody whom you love has problems like high blood pressure, diabetes, heart attack or a kidney problem, this episode is for you. To help us understand this better, we have three leading specialists, Dr. Sujoy Ghosh,
Hello.
Dr. Soumitra Ray, and Dr. Ritesh Kauntia. Thank you, doctors, for joining us today. So many people think heart diseases, kidney diseases, and diabetes are are of different conditions, but they are actually part of something called CaReMe disease. Dr. Soumitra Ray, if you could explain us what this means and what's the importance of it, basically.
We always knew that for proper functioning of a human being, all the organs should function properly and in synchrony. There must be an orchestration. But of late, we have found out three different areas which should actually work absolutely hand in hand every minute. Those are heart on one side, kidneys on one side, and the metabolic disease, which includes mostly for today's discussion is dysglycemia, that is diabetes and related conditions. And now we know that they are so deeply interconnected that not only one disease enhances the disease of the other systems, but actually they have got a common root as well. So once a person has got a heart disease, it is our duty to find out whether he has got diabetes or kidney disease. Similarly, if Dr. Kauntia gets a patient of kidney problem, he must see that whether the patient is already suffering from heart disease or diabetes. Dr. Ghosh, if he comes across a diabetic patient, must explore to exclude any existence of already happening cardiac or renal problem in that person. Not necessarily the patient will forward you with all the complaints or all the symptoms or all the signs. So it is our duty as a team of doctors to find out if the patient comes by chance to one of us, to exclude whether he is a candidate to be seen by the other two of my colleagues. So that is the whole concept of CaReMe, which has been given different names over past few years. But recently the American Heart Association president actually addressed it very emphatically. In whom they are over the last 2 years, this concept has expanded like anything, and we now already getting the early benefits of this wholesome approach.
Okay, that's a great point. So, Dr. Kauntia, from a kidneys perspective, how does CaReMe impact the patients?
The kidneys are vital organs of the body. So basically the kidneys are functioning 24 hours and it is a filtering unit. And kidneys are composed of millions of nephrons. So because of these disorders, that means because of diabetes and the related disorders, what happens, the kidneys get affected. And when these nephrons get damaged, the nephrons which are surviving, they start working more and more. And slowly, as kidneys are progressive disease, they also get damaged. And this kidney disease, which was at a very early stage, starts progressing and the patient finally lands up in dialysis or kidney transplantation. So it is very important that this disorder should be detected at a much early stage. And that is very important because if we detect it at an early stage, we can modify the illness and stop the progression at an early stage. because once it becomes a late stage, it cannot be reversed. And that is why the clean approach is important, that we should screen the patients at the right time so that we can detect the kidney disease at the right stage.
Okay, great. So, Dr. Ghosh, one question to you is, since metabolics like diabetes are the center of CareMe, what should people think about it?
Right. I think first of all, I would like to highlight what Dr. Soumitra said is that, we have to move out from this concept of being an organ specialist and look for holistic management. And one of the things that is postulated is at the center of everything is a common disease, what we often call a common soil hypothesis. So, in an individual who has hypertension, he is more likely to have diabetes, he is more likely to have bad cholesterol levels, and all of this is not going to selectively affect one organ. It's going to affect the kidneys, the heart, the liver, the brain, all the blood vessels in the body. So, and not everybody will have all of these complications. So, what, like he highlighted, if you have A, look for B and C. If you have B, look for C and D. Look for all of them. And basically, the underlying mechanisms of the disease probably have common etiology, including insulin resistance being the key. So, some patients might present to us with diabetes, some patient might predominantly present with liver disease, somebody might present with polycystic ovarian disease. So, to think of that it's different disease conditions, it's like few blind men trying to fill up an elephant. Someone is filling up the trunk, somebody is filling up the legs, somebody is filling up the body. So, it's part and parcel of the same disorder. And for a common man, I think he probably understands certain things easier. He understands a blood glucose test, he understands a blood pressure test, he understands a cholesterol test.
Right.
So, screening for all of those individual risk factors is important, even more so important when you have one of them as positive. And if you do have it, any one of them, look for diseases in every organ. Don't just be satisfied with the blood glucose being controlled or the cholesterol being controlled or the blood pressure being controlled. And one organ dysfunction plays a role in the worsening of the other organ dysfunction. So, it's all interconnected. Therefore, when you're managing a patient, you'll have to manage as a whole, as far as part of a holistic management.
Right. So, as we get from you that it totally interconnected, these three diseases. So, Doctor, we had been hearing that heart diseases, kidney diseases, and diabetics are actually growing in India. So, we want to know that how bigger is the problem, and if you can share some insight on CareMe disease. On that.
Yeah, actually, as the Indian population is growing in age, now the average age is quite a decade more than what it was 20, 30 years ago. So we are getting this aging population. Along with the aging population, we are getting the social diseases as well, that people are getting more hooked to the machine and the instruments and gadgets rather than working on the field, working in the on the streets, etc. So our body exercise has decreased. Our cooking time is reduced, so we take more and more junk foods, and you see all the restaurants are always full. You never get a table, even on a weekday. So all this kind of food habit. Then the stress and strain of ambition, of rat race, and these things also kills you every minute. So all those things are increasing in India. India is still a growing nation. And very unenviably, India is the diabetic capital. We have very proudly surpassed China very recently. That there are more diabetic in India than in China. So that is, we can be very pleased about that statistics. And more patients are dying of heart disease in India. So India government is also now shifting its focus to non-communicable disease, like heart disease, like cancer, like diabetes, rather than infection disease like malaria, tuberculosis, etc. So we understand the problem is growing and we are taking action on that. And very important thing is that around 30% of Indian population, adult populations, are already high blood pressure patient. Around 15 to 20% of adult population are already diabetic patient. And of the diabetic patient, almost two-thirds have got heart failure, almost one-third have got some kind of cholesterol deposition disease, and almost half of them have got early kidney disease. So you see how they grow and push each other. And if you see them collectively, it's a huge burden, national burden as well as a global burden. And whenever the Indians are going outside and settling, the Indian diaspora in America, in Canada, in Australia, in Europe, they are carrying this genetic trend and this environmental and personality trend with them. And Asian living in America is much more vulnerable to have diabetes and heart attack than an ingrown American person. So we are spreading like anything. Asians are settling everywhere. Indians are settling everywhere, and these diseases are settling with them also.
Right. So, Dr. Ray, over the last 5 to 10 years, if you could tell us about the numbers or how has it grown in terms of percentage, if you could.
Yeah, actually, the diabetes is growing by leaps and bounds because of Dr. Ghosh will explain of our lifestyle, of our stress. But at the same time, good news is that we are getting good and safe medicines as well.
Right.
Education is spreading so that people are a bit more aware of the lifestyle. So it's projected that it will grow 3 times within next 20-30 years. By 2050, it will be 3 times more hypertensive, 3 times more diabetes. Heart disease will increase like anything around 40%.
Okay.
So these are the figures, but it's not nice to know the figures. It's better to change the figures rather than to memorize the figures.
Right. So, Dr. Countier, do you see this reflected in your clinical practices?
Yeah, next that one that since it is all the three diseases are interrelated, and India is the diabetes capital of the world, so we can understand that many of the patients who have diabetes are developing end organ damage, like cardiac disease, like kidney disease. Now, since patients are living longer, they will have the other organ involvement like kidneys, liver, stroke, cardiac disease, and that is why we are seeing lots of patients with chronic kidney disease in our daily practice. If you look at the data, every year around 2 lakh patients are landing upon dialysis in India at present. And like sir told that 1 in 3% is having kidney disease if with diabetes. And if a patient has hypertension, 1 in 5% will be having kidney disease. So that is the amount of number of patients which are there in the society. Many people are not screened, and who are screened, they are not properly treated, and that is why it is very important to bring this in front of them that they have to take care of that disease at the right time, and so that the disease can be treated at the right time.
Right. So, Dr. Ghosh, are diabetes also growing in the younger generation?
Right. So when we were kids, we had this notion that diabetes develops in age groups say 50, 55 and above.
Right.
That's what we were kind of had the notion of. Right now, 70% of people who develop diabetes in India do so before the age of 40. So there's a very big paradigm shift in terms of the age of onset of diabetes. So the government of India has a guideline on the non-communicable diseases, which says every Indian should be screened for diabetes after the age of 30. And I believe that that guideline too is flawed, because that age cutoff should be lowered even further. So younger age, onset of diabetes, very bad. And one of the things that's happening is at least 10% of all acute myocardial infarction is happening before the age of 40. So we need to start screening people at a much younger age. And we've got to remember that one of the major determinants of complications of diabetes is duration of disease. So if you develop the disease at age, say 50, 60 thereafter, your lifetime complication risk versus if you develop the disease at age 20, obviously there's a big difference.
So many people ignore health issues before they become really serious or it becomes big. So, Dr. Ray, what are some early warnings so that we get to know from before?
All systems do give signals and nothing comes out of the blue. Actually, there is a saying that no heart attack occurs without any warning, but we just miss the warning. So what happens from my cardiovascular system, what I can tell, that the usual things people feel is getting tired and fatigued, less energy. So perhaps he was working 8 hours a day before, now he gets tired after 6 hours. Maybe he was climbing 3 staircases at a stretch. Nowadays, after 2 steps, he has to stop for a few seconds to take the dip, to take the breath back. So these are very early signs that something is going wrong in your heart. Not necessarily you have to have a crushing pain in the chest or you have to faint on the street. Those are very extreme cases when the disease has progressed too much. But the early things are these: when you get fatigue, when you get tired, when you get a bit of swelling of your legs at the end of the day, when you get a bit irritable, when you get a bit out of breath while going to a hill station, which was not there 2 years ago when you visited the same place. So these are the few things what you should be careful of. You should be more careful of these facts if you are already running a risk. That means you know that I am smoking, I am anxious person, my body weight is high, my family history, my parents died early. So if you have got these clues in hand already, you know you are already a heart patient until proved otherwise. So you have to prove that you are normal rather than to prove that I am diseased. And thirdly, of course, if somebody by routine health checkup, there is a very big role of routine health checkup. At least in the we say between 20 and 40 years of age, every 5 years you do a routine health checkup. After 40, you do it every 2 years or every year if you can afford to do it. And then many things which are latent without any warning can be surfaced and can be treated. And you know, if you can treat early any disease, which is much more controllable than when it is advanced. It is not only true for cancer, it is true for all diseases. So I would say don't ignore any health sign. I mean, don't you have to have a specific anything. However, I'm not feeling the same as I was feeling 1 year ago. Whatever it is, you may not specify it, but then it is the time that you should have a thorough health checkup.
Okay, great. So, Dr. Kauntia, kidney disease don't always have symptoms early on. So, what do we do about that?
Yeah, basically in the kidney disease, the biggest problem is that 50% of the patients don't have any symptoms
Okay.
and they present to us at a very late stage. And that is why usually we say that screening is the most important tool for detecting the kidney disease at an early stage. But some of the symptoms which patients can present with, basically, since kidneys are the filtering unit, so whenever that the filtering unit is not working properly, so what they happens is that they start accumulating fluid in the body, and that's why they come with breathlessness, swelling in legs, facial puffiness. Many of the patients have urinary symptoms, that they are going to the toilet at night multiple times. They have some blood in urine, they have some burning in while passing urine, or the urine quantity has reduced. If these symptoms are there, then they should get themselves evaluated for the disease. And many times they don't the symptoms are very non-specific, like they are not feeling well, or else the appetite has reduced, which are very non-specific symptoms. So if you have any non-specific symptoms, then you should get yourself tested for what the problem is. And if you don't test, this disease cannot be detected early on.
Okay. So, Dr. Ghosh, how can someone know if they might be developing diabetes?
Right, very tricky question. In the sense that, we have traditionally been taught that if you lose weight, if you're going to the loo much more than usual, maybe eating a little bit more and losing weight, that you have diabetes. These are what we call the osmotic symptoms of diabetes. If you're going to wait for those symptoms to appear before you go and test, you will miss 50 to 60% of your patients, if not more.
Okay.
So the first thing that I would like to re-highlight here is, even without symptoms, test regularly. At least the first test should be by the age 25, even if you don't have any risk factors, even if you don't have any symptoms. Thereafter, the frequency would depend upon the family history, your body weight, whether you've got polycystic kidney disease, whether you have hypertension, whether you have high cholesterol level, or whether you have other complications. Those would be other reasons. But please do not wait for symptoms. Please do a blood glucose test regularly. And maybe some people will come back and say, oh, I had a corporate checkup 6 months ago and it was absolutely fine. You might still develop the disease. So one of the things that if you're really hell-bent upon figuring out is going for a risk score.
which you can look at looking at your obesity, whether you've got darkening of the skin around the neck, the groins, and the axilla, whether you have a family history for a lady, whether she had pregnancy related diabetes in the past, which went away after the delivery of the patient, polycystic ovarian disease, a fatty liver, high cholesterol, high blood pressure, all of them will probably give you a better idea, but don't stick to symptoms. Test, test, and test.
Okay, that's great to know. So, we had already spoken about the problems as of now. So, we also want to know what the solutions are. So, Dr. Ray, how would a treatment for CareMe look like? What should be the process?
The CareMe concept, as I mentioned, was brought on by the American Heart Association to start with. And they gave a very standardized protocol of how to approach the CareMe or the CKM, what they call it CKM, that is cardiac kidney metabolism. So there are different terminologies for that. And there were 4 stages, 0 to 4. And 0, is the, as Dr. Ghosh was mentioning, the presence of the risk factors, whether the patient has got pressure, sugar, cholesterol, family history, stress and strain, etc. So you tightly control all those risk factors with lifestyle, with diet, with counseling, with exercise, if necessary with medicines, so that the patient doesn't go on to stage 1. So stage 1 is the obesity. Obesity has been identified as a central part of all these CareMe symptoms and signs and diseases. So obesity can be excess fat or can be bad quality fat. Both are obesity. Some people have got extra fat which you can see. Some people have bad quality of fat which you don't see, but you have to find out. So obesity is the center of these things. When you have got obesity stage 1, you have to reduce the body weight or control your fat. That is the central. Unless you do it, everything falls flat on your face. Then stage 2 comes when gradually this kidney, heart, and other end organs start getting damaged. In stage 1, stage 2, and then in the terminal stage, you can't do much about it. But we have got now medicines, both for diabetes, for heart disease, for kidney disease, which are complementary to each other. 10 years ago, we had certain diabetic drug which exacerbated heart failure. We had certain cardiac drug which exacerbated kidney failure. We had certain kidney drug which exacerbated heart failure. But nowadays, days have come, those medicines are going out. So we are getting those kind of pharmacotherapy only, which not only targets the primary disease, but also has to take care of the other organs as well. At least should be neutral. It is no logic nowadays to treat your sugar and harming your kidney. Then that is not accepted. That medicine is banned by today's world. So nowadays it is, as we mentioned, a holistic approach. So even our pharmacotherapy has to pass the test that fine, you are controlling heart failure, but are you exacerbating sugar? Are you causing kidney damage? Then your drug is not licensed.
Okay.
So now this is the theme that every medicine should not only primarily target for which it is discovered, but at least should be neutral, if not beneficial, to the other 2 organs primarily. So that is the whole approach of CareMe or CKM, and we are already reaping benefit. We are having far better control of sugar, far better control of heart failure, of heart attack, as well as kidney progression. Within the next 10 years, I think the future is very bright, and you will have less and less people coming with heart attack, coming for dialysis, coming with diabetic complication like gangrene of the toes, etc.
So it's always better early than realize
Absolutely.
it later.
Yeah.
So, Dr. Countier, what would you talk about if you could talk about kidneys protection?
So basically, for keeping the kidneys healthy, what needs to be done is that the metabolic control has to be there. So the diabetes control has to be from day one. It is not that many of the times what happens, the patients when they come to us, they say that now my sugar is under control, but why is my disease progressing? They forget the karma which they have done in the past. So what is important is that they should have controlled the sugar from day one. and something is called metabolic memory. If they had controlled their sugar from day one, then that would have helped them now. Controlling the sugars now when already the organs are damaged, it is not going to help them. So it is very important that they should control their sugar all the time. Secondly, if they have high blood pressure, that blood pressure needs to be controlled. The diet has to be proper. That is, you have to take less salt in diet, more fruits, more vegetables, and less of oily food, less of red meat. Those things have to be avoided. Again, a healthy lifestyle includes a regular activity. You need to exercise and keep your weight under control. That is one of the most important factors which can help. Drinking adequate water is also very important. Basically, in the early stages of the disease, when the organs are not that damaged, then adequate quantity of water is required. But in the late stages, we try to restrict the water intake. That is important. Then, for keeping the kidneys healthy, we should always avoid certain drugs. Like nowadays, if you have some pain, you go to the pharmacy counter, and you take a painkiller. So those drugs should be avoided because they can also cause kidney disease. So this is basically the general guideline or the golden rules which we say to keep the kidneys healthy. And basically, like what everybody has told, that screening is one of the most important tool, because without screening this disease cannot be detected at an early stage. And that is why this year, like in the World Kidney Day, every year we have World Kidney Day, and we have a theme of "Are your kidneys okay?" so that we can detect all the patients who are at high risk. And the high risk is if your age is more than 60, if you have diabetes, if you have hypertension, if you have a family history of kidney disease, or if you have any other organ involvement like heart disease, then you should get yourself tested for the kidneys by a simple test like creatinine and a urine test.
Okay, so basically what we get is doing a lot of exercise, having a healthy diet is the most important thing, along with also the water intake.
Yeah.
Right. So, Dr. Ghosh, what's the best way to control diabetes in terms of protecting our heart and our kidney?
Right. Ideally, we should prevent diabetes from happening in the first place, which would probably mean that even when the mother conceives her child, there's good metabolic control and a child is born to a healthy mother. There is enough evidence to suggest that what you do in utero, there is epigenetic programming, and that decides whether you will have diabetes and other metabolic disease and complications in later life. So it starts there, followed by healthy practices including breastfeeding, avoidance of obesity, good lifestyle. And if at all things haven't gone right, you've put on weight and you've developed diabetes, to detect it early. Early detection is a key because only then you can reverse things. If you're talking about managing, it would be management of the risk factors and it would be a management of organs for organ protection. So number one, if you're obese, lose weight. Number two, if you're having tobacco in any form, stop it. Number three, no added salt, no extra salt. Cut down on your salt. Control your blood pressure. Don't forget your cholesterol medication. Don't be glucose centric. That means you are thinking of only my postprandial glucose level is 250. The entire management is important. And when you're talking about blood glucose management, what Dr. Ray said, nowadays, for each of these risk factors that we are talking about, we are not only talking about targets of what we want to bring it down to in terms of the blood pressure, the cholesterol, the sugar levels. What agents are you using to bring it down? For example, we have drugs like SGLT2 inhibitors and GLP-1s, which we are now preferentially using in type 2 diabetes for not only very good glucose control, but controlling the other metabolic parameters, for example, the weight and other things, and providing organ protection. So these classes of drugs would reduce the risk of heart failure, would reduce the risk of having a heart attack, would reduce the risk of progression of kidney disease, and would reduce the risk of other micro and macrovascular complications, including eye problems, leg ulcers, and things like that. So it has to be an all-round approach rather than just thinking I'm going to just treat my diabetes with a blood glucose lowering tablet.
That was really helpful and insightful. So, before we wrap up, we would like to take some advice from all our three panelists. So if you could start.
Right, I think during the last question that you asked about management, I had highlighted about certain things in terms of non-drug management, and drug management. Most importantly, if you still tell me, I would say prevention of metabolic disease is most important. Avoid those things in life which will help in emergence of the risk factors. Don't get fat, don't put on weight, have a healthy lifestyle, reduce the fat and oil content, increase physical activity, reduce salt intake. You can't change your genes, but you can change the way you're running your life. So that's number one. Number two, be conscious that you need regular screening for diseases and risk factors. So regularly screen whether you have risk factors. If you do, seek help and look for complications in organs, and make sure that the treatment is holistic. Stick to the treatment. Adherence is important. What is more important in the discussion that came up is hit hard early. Don't wait for years and say, oh, you have just got a touch of diabetes, because most of the benefit will come what you do early. So start early, be aggressive in the management, continue being aggressive, and lead a healthy life.
Right. Dr. Ray, if you could.
In continuation of what Dr. Ghosh said, I would first say that health awareness is the most important thing that our country needs at the moment. So health awareness, there are so many stakeholders. Everybody should take an active part in increasing the health awareness. It is the responsibility of the media. It is the responsibility of the government and politicians. It is the responsibility of the social workers, as well as it is the responsibility of doctors, of course. But doctors can't reach people that much. So those people who can reach, like celebrities, if they can advertise for healthy lifestyle rather than pan parag and gutkha,
Absolutely.
that will perhaps make a difference in the health of the nation and health of the society. I think everybody, we expect, even the celebrities particularly, they should have some social responsibility. That is very important. Money is not everything in life. So number one is the health awareness. Number two is that facilities. Say a person becomes health aware, then he doesn't know where to go. He has got nowhere to go to check his health. It may not be applicable, may not be imaginable in a city like Calcutta or in a Mumbai or Delhi, but in a village, in a small town, even if people know from the television or print media that yes, we need to do this, we need to do the cervical screening, cancer screening, and diabetes screening, they know how to do it. So it is a responsibility of government, the NGOs, the local councillors to get the medical camp, the facilities, so that people have got easy access to healthcare. Thirdly, I would say it is a corporate responsibility of the pharmaceutical and drug device industry to available, make the drugs available at a cheaper rate, at an rate which a common Indian can afford to have. Because most people, even when they know that they need a drug they're serious about it and they want to take it, but they can't do it, can't afford to take the medicine. So I think there are a lot of things happening in the government levels, both at center and at state level, that people are getting cheaper drugs. Then the responsibility comes to maintain the quality of those cheap drugs. So that is another third area I would emphasize. And fourth area is I would request everybody to take more and more health insurance, which is appallingly low in Indian subcontinent. Because then the people get problem when they get got a serious problem, they don't have the money. Nowadays you can say there are various schemes of government and semi-government so that you get most of the treatments free of cost, but it's not always true. And even if there is a limitation of that. So if at all possible, it's better to spend money on insurance premium rather than to spend money on cigarette or your alcohol. So many people, I say, if you stop cigarette smoking, you save in the one hand, not the upfront cost of buying the cigarette, but also the down cost of the health issues which you will face by smoking that cigarette. You have to treat your lung cancer, you have to treat your heart attack, you have to treat your peptic ulcer. So those costs should be added to the cost of what you are adding to buy the cigarette. So you see, these are the few things which people must be aware of. We should tell it again and again and again. starting from the school level, because as Dr. Ghosh said, unless we change the personality, people's personality don't change after the age of 18. It is now proved. Unless there is a serious havoc in the personal life, people don't change. It is there, suppressed in them. So the growing up of the children to bringing up the children is the parents' responsibility to tell them what is healthy food, what is healthy lifestyle, what is healthy exercise, what is healthy attitude, what is healthy personality. Yoga and pranayam India is a seat for that. But how many people know the importance of yoga and pranayam, how to do a proper yoga and pranayam? If you can spend that time, 15-20 minutes out of your internet surfing from your mobile phone and give that time to some asanas and deep breathing, you can enjoy the internet for 50 more years. Because if you die, you can't enjoy the internet anyway. So these things has to be hammered. When you say that you have to wear a helmet while while riding a scooter or wear the seat belt, people think it is to oblige the police or the government. It's not. It's to oblige yourself. Government, police doesn't care if you die. It is your responsibility to live. So that helmet and seatbelt is for yourself. So whatever you are doing, the healthy lifestyle, the government or the doctor may advise, but government or doctor doesn't care if you die. It's your problem to live. So unless you think that you are doing it for yourself, not to oblige other people, until that thing comes, it is very difficult to get a healthy nation.
Right. So, Dr. Kanti, if you
Yeah, basically, I would like to say that healthy lifestyle, like uh, everybody has said, that is the crux of that is the crux which everybody should maintain. And if they are at high risk, then they should get themselves screened. And if on screening there is any abnormality, to get a specialist checkup at the right time. And this is how we can detect the disease at the early stage, and more patients can be benefited with it.
okay. So that's a fantastic advice. Thank you, doctors, for your insightful discussions. And to our listeners, your health is in your hand. Focus on CareMe health. Make small challenges today and protect your future. Thank you.